So today, where we normally would have our Integrative Health and Lifestyle program Q&A, we are lucky to have an alumni panel of IHeLp graduates come and talk about their experience and the impact of IHeLp. So you don't have to just listen to me. Should introduce myself. I'm Molly Burke. I'm Director of Online Education. I'm also Director of our Integrative Health and Lifestyle program and our Wellness and Lifestyle series here at the Andrew Weil Center for Integrative Medicine. And one of our panelists, unfortunately, is delayed a bit because she's with a patient. So as soon as she can join us, we'll get her caught up and answer some of the questions. But we do have Songsaray Washington and Heidi Closer with us today, both graduates of IHeLp. Songsaray is a physician assistant and Heidi is a nurse practitioner. And I'm going to go ahead and stop sharing so we can see everyone's face. If you are able, go ahead and take your cameras off. It's always nice to see who's with us, but also totally understand if that doesn't work out for you. So I'm going to go ahead and get started. Sorry, let me get my PowerPoint ended there. The first question, I'll start with Heidi. If you'll just tell us a little bit about yourself. Where are you joining us from? What's your professional background and what does your practice look like right now?
Hello, everyone. Thank you so much, Molly. It's great to be here. And I'm joining from West Hawaii. I've lived here for about 3 years. I used to live in Tucson, so that's kind of how I learned about the program, is when I was living in Tucson. Professional background, I've actually been a nurse over 16 years. Got my bachelor's through the U of A, University of Arizona in Tucson, and then got my doctorate back in 2017 for family nurse practitioner. So I've been a nurse practitioner, I guess, for over 7 years now. Time flies. So as far as where I started out, so nursing, I did critical care for many years. I did float pool in the hospital, and I did interventional radiology. It really made me, my years in critical care, want to look at seeing people outside the hospital and trying to prevent some of the bad outcomes that unfortunately we saw many times in the ICU. So I got my family nurse practitioner, worked in a federally qualified health center since 2017. So I've been there over 7 years, doing primary care for underserved, uninsured, underinsured, so really vulnerable population. And I love this population. So I've been there whenever we did this move to Hawaii for family reasons and other things. My husband's family he grew up in Hawaii and his family's here, and we wanted to be closer to them. So darn it, had to be paradise. But whenever we moved, my work actually kept me on doing telehealth, which has been great since the pandemic started. So I still see patients in Arizona doing family practice there, which is amazing. And then I also have a part-time kind of per diem position on island. 2 days a week, I do either urgent care or family practice. So I kind of float in between those two areas, which is great because sitting on the computer all day is not super fun. So I'm glad that I get to also see people in person. So it's been wonderful. And that's kind of my background.
Thanks so much. That's great. Songsaray, tell us about yourself and your professional background and practice.
Yes. Hi, everyone. My name is Songsaray Washington. I graduated from the IHeLp program in 2023. I'm a physician assistant, and I currently live here in Cleveland, Ohio. I started my PA career in 2018. I've worked in chronic wound care. That's where I started, and transitioned to pulmonary medicine. When I worked in chronic wound care, I was living in Western North Carolina. It's a very rural area, undeserved area, lack of resources. And, being a first-time PA, new role, it was very daunting. But it really brought me into learning more about internal medicine, like towards the end of my career there, and how I approach chronic wounds. And I'll get more into like chronic conditions later, but eventually I moved on to pulmonary medicine. And interesting enough, I started pulmonary medicine right at the height of COVID pandemic. Like, so that was an interesting time learning pulmonary medicine and COVID at the same time alongside my colleagues. Well, with that, I took care of mostly asthma and COPD patients, but also it reminded me of my time in the chronic wound care because I was dealing with people with chronic conditions. I had a very narrow view there about like how to treat any specific disease. But what I realized about it took me back to a memory when I was doing a internship, or I guess you say like clinicals at the VA, and I came across Dr. Raquel's Integrative Medicine book. And when I was looking at it, I thought, wow, they bring a whole nother approach of holistic care to treating people with chronic comorbid health conditions. And it kind of just hit me. So it was towards the end of my pulmonary medicine that I realized I wanted to learn integrative medicine. So because I felt like I was missing something in my care with treating the patients. Like I knew the medications to prescribe, I knew the rigmarole, what to say, but to really heal folks, that's where I came across IHeLp, and they've been instrumental in bringing that other perspective for me. So currently, right now, I do work at a military processing station, just PRN role, doing history and physicals. But I also am starting my own like health coaching business online. And I've also just started a podcast back in September, and really, they're just like 5-15 minute blurbs about just integrative health tips that people can um, add into their lives. Yeah.
That's great. You got to share where you're at so I can find your podcast.
Oh, yeah. It's called Underneath the Plate on Spotify.
Oh,
For those interested.
thank you.
Mhm.
All right. So, Sanctuary, let's stay with you for a little
Mhm.
bit. What are some of the benefits that graduating from IHeLp provided for a physician assistant or other physician assistants out there?
Yes, yeah. One of the benefits from graduating from this program is that you get a certification in the program. And I think that's helpful because you can put that on your CV. You can showcase that when you're applying for new jobs or, something in that realm there. And I also liked how, also about the program, I did have an experience once where this a program that I was in was in threat of losing their accreditation. Now, IHeLp is not an accrediting program, but the fact that, I researched them, spoke with them, this is a very scholarly and evidence-based program that is definitely worth the worth the time and the education. So that's what I was like really proud of. That I felt like I was getting a strong like foundation. And let's see, the second benefit I have here is you get to be part of the alumni family. You get so many emails with information though. I don't feel like overloaded with the emails, but you get offers on new free webinars to join that are about integrative topics, just from business ideas. Also, as well, you get discounts too. I know Dr. Weil sometimes gives discounts on his matcha tea, and I love matcha tea. So that's a great benefit. A third one I have here is you're leaving with knowledge that a lot of practitioners across America don't have. What I mean by that is I even went to my own doctor and they teach in the conventional medicine of here's your symptom, here's the medication. You know, here's the disease, here's the medication. You're leaving IHeLp with holistic knowledge. Nothing bad about pharmaceuticals, but you're going to have more of a different perspective to bring into your treatment plan. Like I remember a quote from Dr. Hyman was that when he got into the integrative specialty, he had to relearn medicine. So I think that's really profound. That speaks to the specialty. And then another benefit that I found, my last one here, was like personal growth and self-discovery. You know, with the IHeLp program, you really get to learn about yourself, and you get to focus on, you know, any healing that needs to be done, just any, you know, growth, maybe a reinvigoration of passion into your, you know, job. A lot of times we can get drained with the 9 to 5 and feel like we're not really benefiting our patients, you know, in that way. But here I felt like I was re-uplifted with the program. I had a new sense of passion. So, yeah.
That's awesome. Thank you. Lots of benefits. Heidi, what would you like to share about what you're thinking what's beneficial to graduating from
Yes,
IHeLp?
and I agree with so many of the points that I'm not sure how to say your name. I don't want to butcher it, but I agree with so many points. And so I just graduated from IHeLp this past July, so I'm fairly newbie to the alumni, but super great foundation. So really, I've been a nurse practitioner for over 7 years, and I always kind of practiced integratively. And I feel like this program just gave me more knowledge and evidence-based learning to where I'm more comfortable now recommending these things to patients. Whereas before, it's like I knew based on my own self-research and things that these things can help, but you're still kind of, you know, concerned as far as making recommendations. But I feel like this really just solidified things for me, and to where I'm super comfortable recommending things, vitamins, supplements, complementary alternative medicine, and the fact that it's evidence-based and seeing all the research, there's very little risk and potential benefit, I think has been a huge benefit to my patients. And like I said, I've always kind of practiced this way, but it's just given me the extra knowledge and foundation to be able to really integrate it into the practice. And as we know, you know, uninsured, underinsured, these patients really need this because they don't have, you know, hundreds and thousands of dollars to go see a naturopathic or integrative, you know, practitioner and pay out of pocket. So to have this kind of built into these systems, and I feel like really empower these patients is very powerful. So I love doing integrative medicine with this population. And actually being in this rural area in West Hawaii, a lot of the patients here are very leery, I want to say, of conventional medicine, and not a lot of patients here really want to take medicine, and they're very kind of reluctant to, you know, take medicine, which I think is great because this gives me an opportunity to empower them and say, hey, these are all the things we can try that's not, you know, pharmaceuticals, conventional. But if we fail in these areas, then you know that we tried that, and then we may need to go to a more conventional medicine approach. But just them knowing that, you know, I'm open and that I can see both sides of it, I think is super, super helpful. So the benefits of the program, like I said, just great information, evidence-based. It helps, you know, not only your patients, but like my colleague said, helps you personally. So many changes I've made positively for my own health as far as nutrition, and really trying to start a meditative practice and physical activity, all that stuff, and seeing how important it is and just how much it impacts our daily lives has been eye-opening. So again, not only benefits patients, but your, you know, yourself personally, and then that kind of ripple effect goes to your family, your friends, etc. So it's been wonderful. I can't really recommend the program enough.
Thanks, Heidi. So I'm gonna try to echo a couple things. So expanding of your toolkits. You both talked about that. Having the the foundation of the evidence in these various areas. And also, one of our curriculum is around how do you stay on top of what the new evidence is, and giving you access to tools out there to support, like consumerlabs.com and natural medicine database, to empower you when you're in the clinic. Then also community and networking, right? So when you graduate from fellowship or IHeLp, you become an alumni, and we're really, really invested in supporting our alumni. It's our relationship doesn't end at graduation, and that's providing, online tools and opportunities to connect, to share info about referred, practitioner referrals, as well as education, and sometimes we have events, which is always nice. So I think that was just some of the things that got highlighted. I know self-care is in there, and we might end up hitting on self-care again in the next couple of questions. So I'll hold off diving into that aspect of the program design right now. So Heidi, I'm going to go back to you. What are a couple aspects of IHeLp that you found most meaningful or impactful?
So yes, and again, I love the entire program, so it's kind of difficult to pick, but it's funny, I often joke to, family and friends that attending school didn't really feel like school because I was just so interested in all the topics. But I really enjoyed the self-care assignments, and then our small Zoom groups after to kind of discuss, and again, building community. I loved the in-depth study of nutrition and all the vitamins and the minerals, because unfortunately in formal education, they don't really go into that, I feel like, enough. And a lot of times with patients, we're saying, yeah, go eat a healthy diet, go exercise, but really, what does that mean? Break that down for me. And so to be able to have that conversation with patients, okay, what do you like to eat? Well, these are some good options for you, and really getting down to the nitty gritty of what's healthy and what's not healthy, I feel is super, super important for us as, providers and practitioners of health. The mind-body connection was super interesting, learning about that, learning about meditation and all these other modalities and how that can affect our relaxation response and, really affect the brain. So that was super impactful. Sleep health, learning how much, sleep affects us. And many times now with my patients, when I'm doing an intake about a certain problem, I'll always ask about sleep because it just affects everyone. And you come to find out, oh yeah, I'm only sleeping, 3 or 4 hours a night. Well, of course you feel terrible, so I mean, that was really impactful. Learning about dietary supplements, botanicals, that was probably my favorite, super interesting. And then motivational interviewing. So really enjoyed learning about motivational interviewing. That helped me quite a bit, not only with patients, but also even with family members. Sometimes, trying to get to the bottom of what's going on with them, I'll find myself kind of going into that motivational interviewing pattern, conversation pattern. So, and then I think just overall the integrative approach to common conditions. So just learning about, how to treat sleep and, diabetes, all those kinds of things, that was just super impactful. So, I mean, again, hard to really pinpoint one thing because the program is just so well-rounded.
Thanks, Heidi. Appreciate it. Sounds right. What were some of the more meaningful, impactful elements?
Yes, just to mention, like from Heidi, that, this is an online program, but it did feel like in person in a way, because the material was presented in a way where you were working with your classmates, like through discussions or through problem solving cases. And the communication was just so like easy to talk to staff or classmates that it just felt like I was still in person, even though it was online. It is a rigorous program, so make sure you keep up. don't want to fall behind, and they will preach that to you all the time. Um, and let's see, I also like the retreat at the end. That was a really awesome time. Like for us in particular, a Gila monster, which is a lizard, had showed up. And this was like some of the staff's first time seeing it. And it has such a nice meaning to it, and a Native American meaning to it. So it was just, that was very magical. I like the aromatherapy class. And, I switched out all my candles, and I was like, I'm going aromatherapy because it's so much better for your health. But you got to make sure you choose manufacturers that don't have toxins. Make that was one of the things that I felt empowered about IHeLp, was now I actually write emails to manufacturers asking about what ingredients or how they process things. Sometimes people get back to me, sometimes they don't, but that just gives you power if you want to, buy into them. So I think I really like that aspect of feeling bold and ask, because I think many like Americans like just don't do that. Sometimes we just take for granted like what we have is safe, but especially like those food color dyes. Nope. I tell her artificial dyes, no. So, um, let's see. Oh, and then access to consumer lab and some of the other resources. I really enjoyed that. Yeah.
Wonderful. Thanks.
Mm-hmm.
Yeah, so one of the things Songstory missed out on, because I piloted it last year with Heidi's class, were these healing talks. So we actually got to have more face-to-face time via Zoom with faculty, as we implemented about 6 of these live virtual, almost like lunch hours with faculty and students asking questions. But I'm glad even without that, right? We're so mindful of how to bring distance learning, humanize and connection in community. So we're very faculty and peer engaged, even though, we only come together physically for the educational retreat towards the end of the program. We are having touch points. Every student is assigned to a small faculty mentored self-care team who also meet via Zoom throughout the program on occasion, as well as support each other while they're doing self-care. And so self-care has been mentioned, and I'll just say that it's an element we've woven through the entire program, start to finish, that we want our students not just to learn about sleep health, but to learn by also applying their knowledge to themselves. So assessing that each other individually. What is my sleep health at? How could I improve my sleep health? And implementing a self-care practice for 10 to 14 days, and then sharing that experience with your self-care team and getting support from them and your faculty mentor. So that's woven throughout. And then yeah, it is a wonderful time when we do come together and have meals together and do more hands-on experiential work during that 4-day educational retreat. So I'm going to go to our final question, and then we can open it up to any participants who have additional questions. Heidi, how are you incorporating what you've learned in IHeLp in your professional and personal life?
Yeah, and so like I said, I'm still kind of a newbie, but I definitely am incorporating it a lot more as far as the integrative approach. The biggest thing I think I've been doing with patients is actually teaching deep breathing techniques, particularly Dr. Andrew Weil's 4-7-8 breathing technique, because it's super easy to implement and it's actually super quick to teach. And like I said, I do telehealth for part-time. So just the other day, I had a young, 15-year-old patient who was suffering from anxiety, depression, and is already on an SSRI, and she's, thinking she needs to increase her medication. And I said, well, hey, let's look at lifestyle stuff, because I really don't like the idea of increasing your medication at this point, And so she's not in therapy. So, you know, we definitely told her you got to get into therapy. We talked about the Andrew Weil 478 breathing technique. We did a teach back, so she was able to teach it back to me. And then we talked about yoga. And then I also recommended a meditation. The one I loved that we learned about in the program was the loving kindness meditation. So I told her to YouTube that. And so we spent a lot of time together, and I think she was really surprised by the interaction because she probably thought, I'm going to see this person, they're going to increase my medicine, and then see you later, you know. And it was just really a good connection. And she understood that, hey, you know, medicine is not the end all be all. There's a lot of other things that we can be thinking about and doing that are truly going to benefit our health. So, like I said, it's just given me more evidence-based education and foundation to comfortably teach these things and to know that what I'm teaching is really going to truly help people. And I'm also looking forward to, and I guess this is another benefit for nurses and nurse practitioners. So I'm gonna, once you finish the program, you're eligible to sit for the advanced practice or holistic nurse board certification. So for me, since I'm nurse practitioner, it's an advanced practice holistic nurse board certification through the American Holistic Nurses Association. So I'm going to sit for that. So in addition to our certification that we get at the end of the program, you can also add that to your credentials, which I think is huge and will be nice for patients to know that, you know, that's my commitment to holistic health. So definitely, I feel like I just scratched the surface on what is going to happen in my future, and it's just made me that much more interested and just want to continue learning as much as I can. But the program is a great jump off point, and I absolutely loved it.
Thank you, Heidi. Thank you. You mentioned so many things. And I also just want to say welcome. Gina Wilcox, our other panelist, is here. Gina, we're going to get to you in a second. If you're up for it, we'll have you answer some of the questions. But just Heidi, just the one point that I want to highlight is you know, an integrative approach, foundational to an integrative approach is that time with the patient, listening to the patient and hearing what can they do, what do they want to do, and just like that alone is such a powerful healing tool, beyond, you know, providing these other opportunities that put some control back in the patient's hands when it comes to lifestyle and mindfulness approaches. Sangsuri, what about you? How are you incorporating? What are some examples of how you're incorporating?
Yeah, after, like I said, graduating IHeLp in summer of 2023, I'm in the process of starting my own health coach online business, and I had just started my podcast here in September. You know, I just felt empowered afterwards to keep the integrative moment alive. I just feel like this is my calling and this is my specialty. And I think just one of the better examples is when I was in pulmonary medicine and I had an asthma patient, you know, she was asking me like, how long do I have to be on this inhaler? And I told her our recommended thing, we always say, was 3 to 6 months. Once your symptoms are resolved with the inhaler, you can, you know, taper off of it. And you don't really need taper, but not too long of one. But anyway, her symptoms came back after 2 to 3 months. And, you know, it was at that point I realized, how am I really helping folks with these chronic conditions? How can I help them learn how to heal but I didn't know. And that's what IHeLp really helped me with, because I personally suffered from asthma as well. And when I went through IHeLp, I was able to get off my inhalers. And actually, like, I had just a cold upper respiratory infection like about a month ago. I didn't have an asthma flare up, and that's like the first time in decades. And what I learned from there, anti-inflammatory diets, improving your inside of the environment. I was using candles that were just way too toxic. There's going to be so much that you're going to learn. And I feel like now I can just help bring this, as Molly said, a toolbox to teaching patients what they can use, what they can look around inside and outside their environment to modify, eliminate, or even add to actually start helping that healing process to get rid, hopefully rid of those diseases. So,
Awesome.
and yeah, I think that's oh, and I would say one last thing too is working at the military station, I see now some of my comrades, they're bringing in green plants, they're bringing in more healthier options. So you will be an influencer to the people around you. So yeah.
That's wonderful to
After
hear.
that.
Awesome. Thanks for adding that.
Mhm.
Gina, thank you so much. I know you were caught with a patient. That's comes first, number one, no doubt. Will you tell us, I'll say, like, I'm just gonna wrap it kind of up in a all-in-one question. Tell us a little bit about where you come from, your professional background and your practice, and then just hit some of the highlights for you around IHeLp and how it's impacted you.
Yeah, I'm Gina Wilcox. I am a psych mental health clinical nurse specialist for over 25 years. It's all I've ever done, and that in teaching. So I also teach in an online nursing program. So I see patients in an outpatient setting, and I was a little skeptical that everything that I was learning in IHeLp would actually be transferable. I thought, "Ugh, these patients are just gonna shoot me down. They're not gonna want to try it." But it's been amazing. When I start bringing things up, how many patients are like, "Oh, I wouldn't have to take a pill. I could do this," and they're really invested in it, and willing to try it. And a lot of times I think it's because they've tried so many pills or so many other things that haven't worked. And so I've been able to kind of catch them, when they're kind of desperate and they're like, "Okay, tell me anything else that could help." um, I think some of the things that I really picked up personally and professionally from the IHeLp program, essential oils, herbal medicines, just really have started incorporating those things into my practice and into my home. Like somebody else mentioned, got rid of the candles, started diffusing essential oils, and it's made a big difference. And the anti-inflammatory diet has been huge. Really kind of joined IHeLp for my personal needs, and it has just spread into my practice as well. And I think one of the big advantages to that is that I've tried a lot of the things that I'm asking the patients to try. So it's not just, "Here, try this. I have no idea if it'll work or not." It's, "Hey, I gave up diet sodas and all of these chemicals that are in them, and this is how it's changed my joint health." And being able to say, "This is what it's done for me, and I think it can help you as well." I think having that personal connection has really helped the sell of the non-medication option for patients. Been able to educate other nurse practitioners in the organization. Been able to kind of take my IHeLp project that I did at the end of the program and incorporate that into some patient teaching modules that we're using for patients now. So it's really been a wonderful, wonderful tool. It is a ton of information. For me, it was, like taking it in from a fire hose. It was just so much information. Let's see, I guess I finished in July. I'm still going through and carefully going through my notes and pulling out pieces. I haven't been able to, incorporate everything all at once. It's kind of a piece here, a piece there. Ooh, what does this patient need? Let me go back to my IHeLp stuff and see if I can figure out what might be a good option for that patient. And then it starts becoming part of my repertoire. So it takes time. It's just a ton of information, but it's amazing information. And every now and then I go down a rabbit hole and go, oh, I want to know more about this. So it's been really good. I've been able to incorporate some of it, of the teaching, into what I'm teaching the mental health nurse practitioners that are in the program that I teach, so help them to look beyond psychopharmacology into other things, especially with sleep. Sleep is one of those things that you can throw a pill at it, but I have so many patients that they've tried every pill and eventually they all quit working. And there's other approaches that are so much better. And so I don't know if that's what you were looking for.
It is.
Molly,
I was like, I gotta write some notes because there's 2 points I want to, that's all wonderful. Thank you so much and very like nutshell, appreciate truncating it. But I wanted to highlight, you mentioned you came for your own self-care and then and realized that you are able to implement it into your patient care, as well as influencing students and your colleagues. And a big part of the IHeLp design was looking at that was we know healthcare professionals are most likely coming in to our program close to burned out or burned out. And then we say, here's 25 different, curriculum topics that we want you to learn. We didn't want that to be add to the burnout. We wanted to, reignite the passion and also do some healing. So that's part of the self-care, but we also did a 5-year research project with IHeLp students to actually assess burnout levels, and burnout levels decreased and resilience increased at the end of the program from before they started the program. So, we're like, okay, we evaluate generally we have program evaluations at the end, but that 5-year study was like, okay, we're on the right track. Our students are feeling empowered, they're taking care of themselves, and they are still able to learn and then bring that learning to their patient care. And the other point was access. Gina, you're like a fire hose, right? Like, I'm going to go back and maybe spend some more time with this after graduation, which is so important. It's one of the reasons why we teach, this is what we're teaching now, and you need to learn how to look at what's coming up or what's new and what's happening in the literature, as well as providing opportunities for our alumni to keep learning. So when folks graduate from IHeLp, then we are putting them into our premium alumni for free the first year. So you have basically an additional year of access to all that IHeLp curriculum. So you can go back and look through things and maybe do the rabbit hole of, I'm going to check out that citation and go beyond reading the abstract on that, or I'm going to start looking at related research. And use those tools that were mentioned, like HerbMed Pro and Natural Medicine Database and Consumer Labs. You have access to that the whole time.
I'm really glad you gave that to us for free the first year, because I don't know that I would have paid for it the first year out, but I will the second year and on, because of how many times I've gone back to it this first year.
Yeah, that's great. And it's a pretty low charge. It's less than what memberships to those, I think 3 or 4 different external tools that our graduates have access to. But yeah, it's again, it's mission forward. We want to make sure that folks wanting to do integrative health and medicine have the resources to keep doing it at that evidence-based level that we're teaching from. So we're at 442 here in Tucson. I do have some slides that kind of highlight some key points that maybe didn't get touched on here, but the most important one is, I just want to say we launched in 2014, so we're heading into our 11th year. We have over 400 graduates. We have over 30 different professions represented. We had nurse practitioners and PA on panel today. RNs probably make up our largest subset, around 25%, but PTs, speech pathology, chiropractic, acupuncture, mental and behavioral health field across the board, dietitians. I'm gonna forget, but over 30 that are already represented in our alumni body, and it's a really important part of the design is that I think we learn better together, to hear our different perspectives and also get comfortable working better together. That we aren't all in these silos, that there are multiple healthcare professionals touching a patient's life or a community's health. And the more that are doing it from an integrative perspective, the better. So, and also thank you for attending. Morgan will provide you with a app fee waiver code for participating today. So if you want to apply for our 2025 class, it's starting in January. We're basically towards the end of that application period, but you can, if you're interested, Morgan will be sending that, so there's no cost to you to apply. But I'm going to get into questions now. Let's see if there were any in the chat. I don't think there were any in the chat about this. So small group, feel free to unmute and just let your questions out, or if you feel more comfortable typing it up, go ahead and type it in the chat. Yes. Is it Cameron?
Cameron, yep.
Cameron.
So just a quick question for you. I am kind of in the search phase of which direction I want to go next. I've been a nurse for 15 years in a small community in Idaho, primarily in labor and delivery, and done the whole, I really liked what she said about burnout. I've done the whole leadership thing, got into education. I've felt that burnout. And I do know, like Sansre described, myself and a lot of patients at my age are seeking just different modes. And so for me personally, I'm at that edge of, do I go to NP school? And I know that there's a fellowship program through the Weil School, but it sounds like from this group that's on this call, a lot of you are advanced practice, and you did mention that there are many nurses in the program as well. But I guess where I'm kind of struggling is, why would this program and how is this program different than the fellowship?
Oh yeah, well I can answer that pretty clearly. Interestingly enough, we've had a handful of nurse practitioners come through IHeLp and love it and go, I'm going to now do a 2-year fellowship. And I'm like, more power to you that you've got that in you. So IHeLp is really focused on providing foundational information around integrative health. We do focus more on health promotion and preventative approaches versus when you get in the fellowship, you're getting in-depth clinical interventions around cancer, around heart disease, although we will cover nutrition and cardiovascular health in our program in IHeLp. Rheumatology, gastroenterology, it's a 2-year fellowship, and it is the same per hour week that we have. It's a 10-hour of work per week, but we're a 6-month program. So you can see, we're talking around 1,000 hours for the fellowship, plus you come in for 3 weeks. They have a clinical mentorship program. So it's a clinical focused fellowship where only advanced, so any prescriber level scope of practice can participate in the fellowship. And IHeLp is open to everyone who's a licensed health professional who is not an MD or DO level. And the reason for that is because the center has worked really hard to support efforts that brought about board certification in integrative medicine. And right now, only MDs and DOs can sit for board certification in integrative medicine. And we want that to be the focus for folks. So, but overall, the center's mission is to provide education to health professionals in as many ways that make it accessible as possible. So, you know, if you are wanting to become an advanced practice nurse, I mean, I think you've got two folks here who can talk to you about that in a general way. But as far as if you are right now looking to move into an integrative practice or have that level of integrative health focus, IHeLp, it's 6 months. You don't need to be an NP, but you can be an NP. Or you can, maybe you're going down the NP road because you'd like to have that level of clinical care, and then maybe you decide then, do you want to do fellowship or IHeLp once you're through school? All right, I talked a lot, and I'm not the alumni. Heidi, Gina, any advice?
Well, I'll just say that I found IHeLp to be like very foundational as far as getting into the integrative specialty, because I had no clue, no idea. And it is very thorough, and you can come out with significant knowledge to be impactful to your patients. I personally plan on doing the fellowship in a few years, just because I just want to delve into deeper. But like she said, that is, I mean, MDs and DOs are in those fellowships. I mean, it's a very, like she says, clinical, very focused base.
And I actually struggled too, Cameron, with choosing fellowship versus IHeLp. And for me, it came down to financially. It was, less expensive to dive into the IHeLp program. And if I can find an employer that will pay for the fellowship, then I would be more than happy to do it. But it was just all financial from my perspective. But I feel like I got the foundation that I needed. And like I said, probably from here is just going to be more self-learning, but I have all the toolkit. And later I may consider the fellowship too. So it's all great information. It's hard to choose.
I wanted to add a quick comment to you guys. Hi, everybody. I'm Morgan. I'm on the admissions team. For folks who are NPs, PAs, PharmDs, and then DDS or DMDs, which I'm pretty sure we don't have any of those on the call today. Or I'm sorry, NPs, PAs, and PharmDs, those three groups. We have a scholarship for the fellowship that's up to $15,000, and only NPs, PAs, and PharmDs can apply for that scholarship. So, if you pursue IHeLp and you say, hey, I want more, and you're in one of those eligible groups, and you decide to pursue the fellowship, I highly recommend applying for scholarships. That $15K is about half of the tuition for fellowship, and it's applied evenly to your fellowship tuition payments. And then I want to mention as well, this is something that's brand new that we're rolling out for this class starting in 2025. We also have tuition assistance that you can apply for through Sally Mae, and that's never been an option before. So I just wanted to throw that out there too. And that is for IHeLp and fellowship. So just something to keep in mind, and I can send everybody a link to, it'll be on the tuition and payment plans information page. I'll include a link to that in the follow-up for everybody.
Thanks, Morgan. Yeah, again, accessibility is always a goal for us. We do have scholarships, and in both programs, and this really cool new feature of these loans, because we've always offered a payment plan options. But even, you know, especially with a fellowship, more options to support that, the better. We aren't like, we're under the university, but we're not university accredited courses and degree programs, so financial aid doesn't apply to us. So it's just another way to help folks. Wondering if there are. Oh, and also we're focused on post-profession education, and so we have a lot of continuing medical education credits and continuing nursing education credits, which is why the holistic nursing American Holistic Nursing Association recognizes us for their board certification, which is awesome. And Heidi, I think you said you're gonna sit for that, which is great. That's like within the last few years they recognized us. They require 48 CNEs that relate to holistic nursing, and they recognize integrative health as in deep parallel with holistic nursing, and we have well over 48 of those credits available in our program. So it's just another benefit. So Una is asking about talk about the graduation project a little bit. I think that's really good. So we have our online courses and other elements, the self-care projects, but towards the end of the program, you will come up with a graduation project proposal, and there's like about 3 different areas that people can choose from. One is like patient education, a public impact by giving a talk or having other way to impact community. You can do a patient case, and then you're saying like, here's how I would address this patient through an integrative lens. People do proposals. So like a lot of folks have done proposals around bringing in integrative health approaches to their like employee wellness. And then they'll like have a whole proposal around that. And that's to demonstrate that you can learn what you've applied across various areas from the curriculum. Additionally, there's a final exam, knowledge assessment exam that a study guide is provided for. But I wonder, Gina, do you want to talk a little more about your graduation project that you got to actually implement?
Yeah, I looked at sleep and I created a tool for providers to use with their patients, and also created a PowerPoint presentation that I presented at our advanced practice provider monthly meeting. So and so you have to look at whatever topic you're looking at from several of the pillars. So you look at nutrition, looking at sleep, looking at environment. So you take all of the pillars and incorporate those into your project. And I found it to be not overwhelming at all. I think once I kind of decided on a topic and worked with my mentor from the program and kind of got the proposal worked through, it was a pretty painless process. But like she said, it is a way to take what you've learned and actually apply it to something meaningful to you.
Yeah, I'm always excited to see what students each year are thinking about and coming up with. It's exciting because it stops being so theoretical. Other questions for our panelists? Well, I just want to thank all 3 of you for giving your time and coming and sharing your story. And just a reminder to folks, if you have questions, please just reach out. One of the things we love to do is Morgan can connect you with an alumni who's maybe near your geographical location or in the profession that you're practicing in, so that you can, you know, get a personalized feedback from someone. It's been great hearing from all of you, and I'm very excited about our January class launching, and then we'll finally work our way towards getting to 500 graduates. So hope to see some of you in that class.